Welcome to the ACME Dental Workforce Security Training. We'll be covering the workforce security policies, specifically the secure use of Tab 32, secure use of Microsoft 365 for email, use of non-company digital tools, company computers, office security, and other concerns. Starting with the secure use of Tab 32, specifically account and password use. An individual's Tab 32 account will not be used by anyone else. Tab 32 passwords will be at least 8 characters long, with at least one uppercase letter and at least one special character, including one of the following shown on this slide. Tab 32 passwords will not be written and left for public access. Tab 32 passwords will not be shared. Accessing from home or public computers. Tab 32 accounts will only be accessed from company computers within the office. Remote access of Tab 32 accounts from company computers through home or public computers is strictly prohibited. Printing patient data. Patient data will be printed only when necessary. Unintentionally printed patient data will be shredded and discarded immediately. Printed patient data that has served its use will be shredded immediately. Logging off to protect PHI. Individuals will always sign out from Tab 32 when leaving their workstation, even if they are leaving just momentarily. Moving on to the secure use of Microsoft 365 for email, specifically account and password use. An individual's Microsoft 365 account will not be used by anyone else. Much like the use of Tab 32, Microsoft 365 passwords will be at least 8 characters long with at least one uppercase letter and at least one special character, including one of the following shown on this slide. Microsoft 365 passwords will not be accessed, will not be written and left for public access. Microsoft 365 passwords will not be shared. Accessing from home or public computers. Once again, and much like the use of Tab 32, Microsoft 365 accounts will only be accessed from company computers within the office. Remote access of Microsoft 365 accounts from company computers through home or public computers is strictly prohibited. Detecting and reporting phishing emails. All emails requesting personal information or login credentials for digital services will be considered hostile, even if sent from colleagues. All emails from unknown senders that include a link will be considered suspicious. Individuals will immediately forward suspected phishing emails to fish@acmedental.com. After reporting suspected phishing emails, individuals will dispose of the suspected phishing email from their inbox. Opening attachments. All attachments from unknown senders will be considered suspicious. Individuals will not open email attachments from unknown senders. Individuals will only open attachments after confirming the identity of the sender. Individuals will not open or run executable attachments. Clicking on links from unknown senders. All links from unknown senders will be considered suspicious. Individuals will not click on links from unknown senders. Forwarding company email to external recipients. Individuals will not forward company emails to external recipients. Forwarding company email to employees' personal email accounts. Individuals will not forward company emails to their personal email accounts. Emailing patient data or not. Individuals are strictly prohibited from sending PHI or protected health information via Microsoft 365 email and any other email platform. Moving on to the use of non-company digital tools. Starting with the Use of Tab 32 and Microsoft 365 from a BYOD device. Personal phone, personal computers at home are included. Individuals are strictly prohibited from accessing their company Tab 32 and Microsoft 365 accounts from their personal devices, including phones, tablets, home computers, and laptops. Prohibiting company data on personal cloud applications like Dropbox. Individuals are strictly prohibited from transferring data from Tab 32 and Microsoft 365 to personal cloud applications like Dropbox and Google Drive, including screenshots. Using or not the Tab 32 and Microsoft 365 suite from a public computer, like those found in the lobby of a hotel. Individuals are strictly prohibited from accessing their Tab 32 and Microsoft 365 accounts from public computers, including those found in libraries and hotels. Individuals are strictly prohibited from accessing their Tab 32 and Microsoft 365 accounts from friends' personal computers and colleagues' personal computers. Individuals will only access Tab 32 and Microsoft 365 from work computers in the office. Use of company computers for personal needs and random web surfing. Company computers will not be used for personal needs. Company computers will not be used for surfing the web. Use of company computers for illegal, dangerous, or inappropriate activities. Company computers will not be used for illegal activities. Company computers will not be used to visit unencrypted websites, starting with http:// and will only be accessed and will only access encrypted websites, starting with https:// All web browser notifications of an insecure website will be considered an unsafe activity, and the activity terminated immediately thereafter. Individuals will not install malicious programs onto company computers. Individuals will not install unnecessary programs onto company computers and will uninstall any programs that become unnecessary at the first opportunity. Individuals will not use company computers to access information they are not intended to access. Company computers will not be used for activities outside of the business operations of ACME Dental. Accepting software updates. Individuals will accept operating system updates when prompted at the first opportunity available. This excludes non-traditional prompts such as a suspected phishing email. Individuals will accept software updates for the Microsoft 365 Business Basic App Suite, including Microsoft Word, Excel, and PowerPoint. Never disabling antivirus and other security controls. Disabling antivirus or other security controls is strictly prohibited. If an individual observes that any security controls are disabled, that individual must notify the office manager. The office manager must re-enable any security controls that are observed as disabled. Use of USB devices. USB cables will be used for printing. USB devices will not be used for data storage or transfer on backup hard drives or thumb drives. Securing the office after hours. All ACME Dental employees will be trained on activating and deactivating the office alarm. The last individual to leave the office will activate the alarm and ensure all of the externally facing office doors are locked upon leaving. Sharing of keys. Individuals are strictly prohibited from duplicating keys to the office. Individuals are strictly prohibited from sharing their company-issued keys with anyone, including coworkers, family, and friends. Visitors, not patients, but friends or family of the employees. Unattended visitors will only be allowed to occupy public areas. Visitors must be accompanied by ACME Dental staff if entering staff work areas. Visitors will not use company computers for any purpose. Visitors will leave the office before the last employee. Leaving the front door unattended. If the front door will be unattended for more than 10 minutes, ACME Dental staff will lock the front door. The office manager will attend to guests entering the front door and verify their identity before allowing them through to the dental chairs. Discussing patient information in public areas. Employees will not mention PHI in public areas, including patient names. If employees overhear coworkers discussing PHI, they will let them know they can be overheard. Other concerns, like attending periodic security training sessions. Employees will attend security training sessions every 4 months. Employees will record their attendance to every training session. Defining what PHI is and how it should only be shared with authorized individuals. PHI is short for Protected Health Information and will include any of the 18 identifiers acknowledged by the HIPAA privacy rule, including names, dates except year, telephone numbers, geographic data, fax numbers, social security numbers, email addresses, medical record numbers, account numbers, health plan beneficiary numbers, certificate and license numbers, vehicle identifiers and serial numbers, including license plates, web URLs, device identifiers and serial numbers, Internet Protocol or IP addresses, full face photos and comparable images, biometric identifiers, that is, dental radiographs, and finally, any unique identifying number or code. Defining what PHI is and how it should only be shared with authorized individuals. PHI will not be emailed through any email provider, including Microsoft 365 webmail. PHI will only be shared with fellow employees that have read the security policies and undergone security training. PHI will only be shared with fellow employees to the extent that such information is required for them to do their job. Reporting concerns that patient privacy or security of PHI has been violated. Any observed concern that a violation of patient privacy or security of PHI has occurred will immediately be reported to the office manager. The office manager must determine if the concern is a breach. The office manager must report data breaches to the HHS website within 60 days if the breach includes data from 500 or more patients, or yearly if the breach involves fewer than 500 patients. Reporting issues or concerns with computers, email, or the dental practice management software. Employees will report any security issues and concerns about computers, Microsoft 365, and Tab 32 to the office manager immediately. The office manager will forward all reported concerns to the responsible party or parties. That is it for the ACME Dental Workforce Security Training.